My name is Emma Schratt, and I work at Catawba Eye Care. I am a licensed optician.
What does that mean?
So for a licensed optician, you have to go through either an apprenticeship program or you can go to college for it, which is usually about a 2 years apprenticeship. You usually apprentice under an already licensed optician, and you do that for 15 to 1800 credit hours. And then towards the end of that apprenticeship, you go and you take a test, which is about 250 questions, has a lot of things. There's a lot of math involved, things with HIPAA laws and just basic eye diseases, conditions, corrections. And if you pass that, you can obtain your license. So really just means you kind of know more than the basic stuff to be able to sell and dispense glasses. I have been here for a year and a half, but I've been in the industry, it'll be 8 years in August. So we do offer contact lenses, sunglasses, eyeglasses. We can do, reading glasses or just distance. And then we also do have extra testing as well. So we can do a lot of scans for the front of the eye, the back of the eye, which not every facility does have that, so usually you have to find somebody who maybe specializes on other things to find that, where you have to go to like a bigger city or something for those. So we do teach contact lens classes as well for new time contact lens wearers, and then we do offer as well, discounts as well for glasses and everything too. We are here Monday, Wednesday, Thursday, and Friday from 9 to 5, and then Saturdays we are here 8 to 1, so we're closed on Sunday and Tuesday. The basic routine exam, you are going to have your pressure of your eye checked, which checks for glaucoma. You're also going to have the visual field, which can check your peripheral vision, and then we also do something called an autorefractor, where that kind of takes what we call like a screenshot of a prescription. Pretty much that's just measuring the cornea and where the light reflects back to the eye, and so we can kind of get an idea of what your prescription is. So that gives like a baseline. And then of course the doctors look in the back of the eye and they can check the retina and the optic nerves. And then the additional testing that we have one that actually can take a picture of the back of the eye that would replace, instead of getting dilation drops, that we can actually save the images and compare them for future uses. So if you have an issue that arises, we can go back and look at, say, last year's image just to see if there's something different with that. We also have a machine that measures the cornea surface. It measures the macula, the optic nerves. Then we also have a antioxidant screener. That one just takes a scan of the palm of the hand. So what it does is it actually measures the tissue in the palm of the hand. It's similar to the tissue in the back of the eye. That we can check for things like risk factors of macular degeneration. So that one's still kind of like a experimental thing that they're doing. So there's a lot of environmental things that we do. Smoking, drinking, diet, health, sun exposure, all that stuff can lead to worsening of like cataracts sooner, or it can lead to things like macular degeneration. So we can do that scan as well.
Why would diet or exercise or smoking lead to those issues?
So just kind of all the toxicities and everything, obviously with smoking, any tobacco product or anything that you're inhaling, it can cause like more swelling and everything too with the eyes and the nerves. So that can lead to things like macular degeneration, retinal detachments. The sun exposure can also lead to the cataracts to kind of form a little bit more, because the sun gives a lot of blue light and a lot of UV. So if you're not protecting your eyes from that, then what that's doing is it can also cause like sunburns as well. And then things too, if you're diabetic, you have to kind of keep up on your blood sugar, because things like those can cause a lot of issues too with the eyes, especially with like the swelling and the nerves and the whole retina area. It's kind of a sensitive area back there. So you just want to make sure that you're taking care of your body and your eyes all together.
Like, how do the tests tell you what to do to me?
Yeah, so, and it's kind of different for everybody. So say you're somebody who has never worn glasses a day in your life and you just kind of come in. That test that we do, where most people know it by looking at either the farmhouse or the hot air balloon, that's the test where we can actually get that measurement of your cornea. So how you need a prescription is really basically based off of light reflections and where it hits at your eye. So if the rays of the light hit behind the retina or in front of the retina, it just depends if you need corrected for distance or for up close. Once you kind of get past the age of 40, you need corrected for the up close area. So for a new person coming in, that would be one of the first few tests that we do, and that gives that baseline. And then when you go into the doctor's room, they do the refraction testing, and they'll, switch back and forth. What's better, one or two? So what you say when you say one or two is what you are visualizing when you're getting that test done. So that's how you and the doctor kind of work together to come up with a prescription. Kids too, every parent's like, oh, I never knew that my kid needed glasses, and you don't know because they just think that's how the world is. They're just used to that. So if that's what you see all the time, you don't know any different to what the world is supposed to look like. So we have a lot of parents come in, their kids start first grade, which is about around the age that we start seeing patients here is 7 and up. And they come in and they do the test, and maybe it shows a little something, maybe it doesn't. They go into the exam room, and then they come out, and it's either yes or no, they need glasses. So kids who are trying to trick into getting glasses, we can tell before they see the doctor. Typically, we would start at 7 years old, so 7 all the way up to 100 plus years old, we start stuff that we take. So you have like your major medical insurance, and then you have what we call like your vision rider. So that's just who your medical picks up as the vision portion. We take a ton of different plans. So the biggest ones are iMed, VSP, Davis, Superior, Spectera. So those are the big ones that we do take and that you'll find most common with. So if anybody doesn't know who their vision is, which that is quite common because they don't always necessarily give separate cards for vision, which is a very big hurdle for us sometimes. Most of the time we can just look it up by name and date of birth, or who the primary is with their name and date of birth, and if we can find it, then we can pull all the information that we would need. We do offer discounts for glasses if you don't have any vision insurance. Everybody else would just pay out of pocket then for it. But most of the time, most of our people do have insurance, but we do have quite a few people that just pay out of pocket and don't have any insurance at all. Some of the testing we do, if you're a first-time patient and you have not been here before and you have not had any insurance on file, then some of the testing we do for you automatically without charging you the extra fee for it, which is about $50. So this is the one that we can check to see for a baseline of a prescription. So the patient would put their chin on here. The machine will automatically move up or down or side to side. And then that will just make that image get clear and blurry. And then on our screen over here, will show up those numbers that we get from there. And then we take the numbers from this and putting in the lensometer over there. Okay, so this one is the one that's going to take a picture of the back of the eye. So you'll see the target's kind of getting blue and green. When we have it all green, we're going to click a button, and then it's going to give her a bright flash of light. At that time it turned red. I would have a better image, but this is the whole back of the area of the eye. So these are all the nerves and the macula, and the whole retina is the entire back of the eye. I took a bad picture, but her eye looks very healthy. The very top image on that left there, that is essentially what we're looking for when we get that picture. When the doctor looks at your eye, they actually only see this area in here at a time. So this little slip that you get, that's what the doctor is able to see when they're looking through their scope. So the image is what gives you a broader view, so we can actually see more of the eye. So this is the fluoropter. This is brought over in front of the patient and adjusted to them. And then a display image pops up on the screen behind us, which that would bring up a bunch of those letters that you see. So a lot of people are familiar with the big chart on the wall. we can use a digital one now instead. So the patient's placed in here, and then the doctor is able to manually control everything with the screen over here. So he'll change the numbers around and ask 1 or 2, which is better and clear. He would answer, and then he would switch and go 3 or 4. So that's how you're finding that information out. This is the slit lamp. So this is the one that the doctor would bring over right in front of you. And then this is how they can actually check the health and everything of the eyes. So that little image that was on the wall that just showed that little horizontal slit, that's what they see with this. And they hold a little magnifying glass up to the eyeball, and they can look at the back of the eye area as well with that. And that's how they can check if you have, an abrasion on the eye, or if pink eye going on, or any other eye kind of condition or disease. They can look through that there. And then, of course, other light images. I guess that was one. So they can also use that as well to look for. There are things that they can do too. If you get something in the eye, they can use the drops. They numb the eye, and they can go ahead and remove it. So if somebody gets like a splinter in the eye or something, they can also do that as well. So we do treat things like your pink eye, scratched eyes, ulcers that you can get if you overwear and sleep in your contacts. That's another something that could happen. One of our recommendations is obviously using a good type of contact lens solution. BioTrue or OptiFeed is a really good option for that. So what you do with contacts is you take them out every night, and you go ahead and you soak them in your solution. And then first thing in the morning, empty out the solution, put the contacts in. Unless you have dailies, those are just thrown away every day at the end. But you never want to sleep in your contacts or overwear them, because you're just depriving your eye of oxygen, where you can get ulcers and just kind of, suck the life out of the eyes. Essentially, you can damage them and lose your vision completely over time. But yeah, just taking them out is the best way to avoid all that. You don't want to use water or soap or anything with a contact, because that can irritate the eye as well. Well, hard contacts are made of a different material. They are actually really, really tiny. They just kind of cover over the pupil of the eye. Instead of soft contacts, they cover more of like the iris and just slightly over past it. So the hard contacts, they're not really a popular fit style anymore. Most people are switching to the soft contacts, but some people do have conditions where they cannot physically wear soft contacts. So they have keratoconus, which is just a condition of the eye. So usually they have to wear a hard contact. There's also another one, which is a scleral lens, which actually covers the entire portion of the eye. That's more of a specialty fit. It's not widely done, but there are a few people that need to be referred out for stuff like that. Just call 419-960-2020 to book your next appointment with us.